So scene one begins as Betsy arrives home. Her care is provided by her son, her daughter-in-law, and a home health agency rehab team, including a nurse, a physical therapist, an occupational therapist, and a speech-language pathologist. They do an initial OASIS assessment and all of their specific discipline comprehensive assessments as they intake her into the home health agency. These assessment findings are entered into their respective electronic medical records and uploaded to Betsy's electronic health record. These initial assessments, in combination with the modified barium swallow study, show that she still does need that rehabilitation before she can be eligible for another modified barium swallow study to confirm she's ready for more complex foods.
So all of Betsy's health data has been stored in the health data manager. And so what this means is as Betsy goes through her continuum of care across all the various facilities, everybody that's providing care for Betsy has access to that same data, that same comprehensive view. So as she's gone, she started home health, she went to hospital, then SNFs, and now she's back into home health. And even within that home health environment, there are many different kinds of folks that need to provide care, and they're not necessarily all under the same organization. So everybody has access to that same comprehensive view of Betsy's data across her continuum of care. So we're going to start looking at that data from the health data manager. So first of all, we see the overall summary of Betsy's data. We see her demographics information, her problem list, right? Labs, allergies, immunizations, her care team, and her last hospital visits. We can drill down to any of these details. If we look at her conditions, as we mentioned earlier, she has multiple chronic conditions. She's had different things going on in her life. She's a complicated patient. We can go through any of her details. We can look at her med list, her allergies, her immunizations, vital signs. I'm not going to go through all these, but, but we will look at her first radiology. This is the first barium study that she did, and we see the results of that first barium study. We've been looking at her assessments over time, but we'll look at the first assessment that was done in early June. So the first assessment is around her mobility, and if we look at the details of that, we can see that where she stands on her lying to sitting on the side of the bed and her chair to bed transfer. And we can see that she's very dependent on looking at those measures at that point in time. And similarly for her communication status, we can see all of the specifics about her ability to swallow at that initial assessment. We can also understand where she stands on her communication measures. And additionally, we also have, we have these additional pieces of information about her, her attention span, her nutritional approaches, her appetite, and her current food and eating ability. So all that rich information is available to inform care at the point of care. And we also have a care plan. So this is, again, a care plan. It's a long-term service and support care plan, really focused on Betsy's care in the home and particularly during this transition in home care. So the thing about this care plan is it's a patient-centered plan, which is critical because we really want this to be a holistic patient-facing plan. So we have a lot of things focusing on the patient themselves. So these are her strengths. So Betsy is actively engaged in her rehabilitation efforts, which is great. I mean, she's involved. She's been showing continual improvement in her recovery process, and she has really active support from both her son and daughter-in-law, where she's currently living. Betsy has some personal goals, and these are more personal goals, but she'd like to stop eating that thickening agent, as she really dislikes the taste, and she's also concerned about the cost. She'd also like to get back to her normal routine and is looking forward to eating normal, healthy meals. So we have this plan that at this stage, it addresses several things. She's going to be getting physical therapy. She needs to be getting speech language therapy, and she needs to be having occupational therapy. So we've created these 3 activities. She'll be getting each one of these 2 times per week during the course of this treatment. We know who's actually performing each one of those details. And we also have a risk assessment. So we have both the description and the risk management plan. So she's at risk for aspiration. And so she's on a modified diet to address that problem. She's also at risk of falling. So they have planned for home modifications to reduce that risk of falling.
Now a month has passed since the beginning of her home health stay. She's been home for a month. She's been receiving therapy from each of the different disciplines 2 times a week, and she's made great progress across all domains of functioning. Betsy's speech language pathologist, Maria Gonzalez, enters a recommendation that she undergo another modified barium swallow study to reassess her ability to swallow liquids in particular.
So we can see earlier I showed you the various assessments that were done in June. Now we'll just kind of review those assessments that were done in July. We can see how she fared on her communication. And we can see again in June, her attentiveness was much shorter in duration. Now it's longer. Her attitudes to her dietary regime has improved. We talk about her understanding of simple messages. That's improved as well. And ability to, actually take in the food. She's, much more responsive in that way as well. And in addition to her larynx function and holding her food in her mouth or cheeks, again, she's no longer doing that. Similarly, we have all the summary information about the functions of digestive, metabolic, and endocrine systems, and we see the results of that as well in summary view. And again, we can see that she's making major improvement. And again, in all of these areas, again, we can see everything's improving, all of these various assessments that have been done.